Hello everyone, here I am going to discuss a very important topic, that is edema and effusion. You usually very frequently get a long question in your university exams on pathogenesis of edema, or else you can get a short or very short question on the types of edema, that is exudate and transudate. So we are going to discuss all here. Let's start it. So let's start the topic, that is edema and effusion. Let's start it. So first of all, I will let you know what's the definition of edema. Define edema. Then I will let you know the definition of the effusion. What's the difference between edema and effusion? The pathogenesis of both of them is same. The pathogenesis of edema, effusion, both of them is same. But you have to understand the difference in the definition. What is edema? What is effusion? Then to understand the pathogenesis of edema as well as effusion, you have to understand normal fluid exchange, that is Starling's law. Then only you will be able to understand the pathogenesis of edema. And finally, I will tell you the types of the edema. So if a long question on edema or effusion is coming in your exam, I want you should write your answer under these headings. So let's start with edema. The definition of edema. What is the definition of edema? How you define edema? So edema is abnormal and excessive accumulation of fluid in the interstitial space. So in simple language, edema is known as swelling. Swelling anywhere, any part of the body. Can you see swelling? Any part of the body from head to toe can swell. It can be external, it can be internal in the organs. So swelling is edema. Now to understand the definition of edema, you must understand what is interstitial space. Now from head to toe, human body is made up of multiple organs. Multiple organs are made up of cells. So from head to toe, we are having millions of cells in our body. So imagine this is any organ and these are the cells of any organ. Can you see? This organ can be kidney, can be brain, can be spleen, any organ. And these are the cells of the organ. These are the cells of that particular organ. Now the space between the cells is known as interstitial space. Got my point? So what is interstitial space? The space between the cells of any organ is known as interstitial space. Normally interstitial space is dry. There is no fluid in that. But if there is abnormal and excessive accumulation of the fluid in this space, so that organ swells up. And that is known as edema. So what is the definition of edema? It's abnormal and excessive accumulation of fluid. Where the fluid is getting accumulated? The fluid is accumulated in the interstitial space, and that is the definition of edema. I hope you got it. So to understand the definition, understand what is interstitial space. And in interstitial space, there is accumulation of fluid. Excessive accumulation of fluid, that is leading to swelling of the organ, that is known as edema. So you can simply see this is edema, swelling. You can simply see this is edema, swelling. You all can see. So it is abnormal and excessive accumulation of fluid in the interstitial space. That is the definition of edema. Now coming on effusion. What is effusion? Now in human body there are many cavities. Like around the lung we have pleural cavity. Around the heart we have pericardial cavity. So normally a small, very little amount of fluid is present in these cavities, pleural cavity, pericardial cavity. But if there is abnormal and excessive accumulation of fluid in the cavity, it's known as effusion. So here it can be pleural effusion, it can be pericardial effusion. You can see here, around the lungs there is fluid accumulation. In the pleural cavity, it's pleural effusion. And you can see around the heart, it's in the pericardial space, the abnormal and excessive fluid collection, it's pericardial effusion. So what we have learned? We have learned two definitions till now. What is edema and what is effusion? Both of them is, the definition is abnormal and excessive accumulation of fluid. Abnormal and excessive fluid. Where if abnormal and excessive fluid is present in the interstitial space, it's known as edema. If abnormal and excessive fluid is present in the spaces, in the cavities of body, like pleural cavity, pericardial cavity, it's known as effusion. The pathogenesis of both of them is same. So to understand the pathogenesis of edema, you have to understand normal fluid exchange. So let me explain you normal fluid exchange. So see, this is the organ. All organs are supplied by pure blood via arteries, the oxygenated blood. So this is an artery carrying pure blood to the organ. This is the artery. Look at the arrow. The artery divide into arterioles and arterioles divide into the capillaries. So these are the capillaries I am drawing. So let me draw the capillaries. The artery is dividing into arterioles and the arterioles divide into capillaries. These all are capillaries. So the fluid exchange takes place. Multiple capillaries bind together and they will make a vein. And the vein will carry the blood away from the organ. The vein contains the impure blood. So what I am saying, I guess everyone knows that. So you can see here I have drawn the capillaries. So